We know that the communities that are often most affected by health inequalities are the most difficult to engage in research. And part of this is because of the huge mistrust that has grown up in those communities of the NHS and the systems around that. Flourish's Community and Cultural Immersion program was put in place to really reconnect people who are in the system with people who are in communities and to reestablish those lines of trust, both with organisations and the people that they serve.
Near my place of work, Heartlands Hospital, we have difficulties getting people into research.
It's always been a bit of a barrier to access the communities that you really want to hear from and to get involved. I think quite rightly they're quite nervous about having outsiders come in.
If I'm honest, the Somali community did not even feel like they were part of research. There is a great mistrust, to be fair, within statutory bodies.
The people we work with, they tend to be quite unsure about research. Lots of disabled people are approached quite regularly to take part in research, and it's not always co-produced. Working with a researcher at DRC has been really, really helpful in terms of breaking down some of those barriers, but also in terms of highlighting some of the accessibility needs that disabled people have.
With Flourish, because they had the existing community links and that relationship, it meant that I was able to go into, these communities and actually listen to first-hand stories of these women.
As researchers, we have been really bad historically at actually talking to people where they are. It was a way of kind of flipping that script and really changing the dynamics.
Elle and I were both welcomed with open arms. We had some great conversations. Women were super open, super generous with sharing with us what their problems were as mothers of children of a whole range of ages.
And I feel like the researchers, as well as us, we've developed a really good relationship.
It meant a lot because, coming from our background in our community, you don't really feel like our voices are heard. So it's really good that someone is coming out to our community and they actually want to hear our voices.
For me, it made me challenge some unconscious biases that I didn't really even know I had. As an early career researcher, it's been a really great stage of my career to have this opportunity, because now it's going to shape the way that I think about research and the way that I plan research.
Monitoring of the Work Well programme is really important. It is a pilot. Based on the results that we've achieved, we'd like it to continue. So actually any sort of data and evidence that we can get that demonstrates its efficacy will be fantastic in terms of securing future investment in the programme.
Creating pilot data to be able to support programmes and funding applications to look at interventions. And we have an opportunity at the moment to do that. And what's missing is the connections between clinicians, researchers and people offering community services. Creating relationships between healthcare institutions and community organisations offering the sorts of services that Disability Resource Centre do, I think is very important in this.
Even though it's a 5-day programme, which for some people might think out of a working day, that is a lot of time. But for me personally, it saved, the Google searching of South Asian communities, domestic abuse and violence, the constant emails. It actually makes sense to do the programme because Flourish have already got those existing links. It's just incredible.
I would really recommend this to other researchers and to clinicians who are looking at clinical research, particularly, to avoid the sort of tunnel vision that you get as a secondary care clinician looking at patients, and having a much broader awareness of the needs of your local community and its patients within that.
Nothing can compare to actually meeting people and talking to them. I think it's a totally invaluable experience.
I hope the lasting impact will be a better understanding between the voluntary sector and statutory sectors, particularly health. But I think ultimately it will be improved outcomes for people.
We are very happy as a community to be part of the research because it means that your voices are being heard. It means that you're being taken into account when decisions are being made about issues that actually concern you.
We can't prevent what happened, but we can prevent what's going to happen in future.
The Flourish Community and Cultural Immersion program is not really about programs or funding or research. It's actually about people. It's about re-engaging people with each other, about creating trust, about starting conversations, about turning up consistently, about building relationships that can last not just for one project but for several, and about putting some of our most vulnerable communities back at the heart of research and making sure that their interests are the ones that we take forward.